Improvement is an important competency that we like to instill upon our residents, and beginning with the 2014-2015 academic year, we did some revamping of the quality improvement curriculum to focus on more of a team-based approach to improving our local practice. And that began in July with Dr. Beachey and 7 other residents who work together. The purpose of quality improvement is to, in my mind, to reflect upon what we're doing here to provide better and more efficient patient care. And in the context of that, we chose, and the group chose, to focus on an issue of reducing unnecessary and costly laboratory testing. It's something that's been done for years. We kind of assume if you're in the hospital, you got to have your blood drawn, right? That's just something that needs to be done. But maybe that's not the case, especially when things have been stable. Maybe it's not really influencing, the results of what we're doing for day-to-day patient care, and can actually harm patients, can lead to things like anemia, discomfort, dissatisfaction.
Right now, reducing spending and reducing unnecessary testing is kind of an important topic in medicine. With any quality improvement project, we kind of identify what the problem is. And so the problem that we identified was that there's an overuse of laboratory tests. And so we decided to start with complete blood counts and electrolyte panels, because those are probably the most commonly ordered tests in the hospital, and definitely tests that likely get ordered unnecessarily on a daily basis. So we performed a root cause analysis, and from there kind of determined what we thought was really contributing to the main problem. A lot of it is provider lack of comfort and maybe lack of knowledge in as far as what the cost of testing is, but also a lack of knowing what consultant expectations are.
I think when I think back to when I was a resident, more was better, it seemed to be the case, and that you felt that you were a better resident if you thought of everything and ordered all of these laboratory tests while someone was in the hospital. But the culture is completely different now. We're very conscious about being cost conscious in the hospital and in the outpatient setting. So over the course of 6 days, the residents on those teaching services would have to add as an extra plan in their daily note if they were going to order a complete blood count or an electrolyte panel, and give the justification of why they were going to order it that day.
We looked at data for a period of about 3 days before we did our intervention, and then we looked at data for a period of 3 days after our intervention. For all of the patients that were admitted in the 3 days before our intervention, we counted up all of the CBCs that were ordered on a daily basis for them, and all of the electrolyte panels that were ordered on a daily basis for those patients. And then we looked at the 3 days after intervention and did the same. What we determined actually was that in the 3 days before our intervention, we had the average tests ordered per patient day was 2.7, and the average tests ordered per patient day after our intervention was 1.8. So this actually turned out to be about a 33% reduction in the labs that were ordered per patient day. So we were kind of surprised that within that short period of time that we had this significant of a result. And I think that it really showed us that just a simple intervention, like providing just some kind of minimal education and really encouraging providers to think about their daily ordering, that really can make a large difference. So I think going from here, what we would like to be able to determine is the sustainability of this, to see if over a long period of time, if this is something that we could really maintain.
Quality improvement as a scholarly work is starting to gain importance as well, because what we learn here is applicable not only in Mayo, but elsewhere. And if our strategies for reducing unnecessary lab tests here have been effective, then maybe somewhere else can use those same strategies. So Dr. Beachey and his colleagues worked to put together a poster to help share that information with others. And Dr. Beachey was able to present that not only at the Minnesota ACP, but they won that competition there for the quality improvement poster, and so he was able to present this work in Boston actually, as well as the national ACP, American College of Physicians meeting.